Hello, friends, and welcome to Specialty Sessions. We're going to be doing sports massage today. I'm at my office using the on-campus computer, so hopefully some screen share PowerPoint stuff can happen. So we have two separate types of sports massage in Massage Land these days. The OG, I'm a cool kid. The original type of sports massage is event-based sports massage. And when people are talking sports massage and they say sports massage, they usually do mean event-based. Like you have an athlete who is doing that that marathon, that boxing tournament, whatever, they have an athletic event. And so we're starting like 2 days before and 2 days after that event. And that's kind of the event-based sports massage zone. And then we have maintenance, like athletic maintenance massage, which is much more common. So this video, we're going to focus on athletic maintenance massage. And then the other video, we will talk about event-based massage. Pardon me. And so let's see if I can get my PowerPoint situation going. Okay, so I'm going to have to do a screen share. I want that one. Share. Okay. I think I have successfully done this. I don't know how to make it be full screen. It seems like the kind of thing that, what's this button do? Fit slide to current window. Nothing happened. Okay, it's fine. Everything's fine. So maintenance massage. So we have some different types of athletes. We have different guidelines and we have different goals moving forward. This portion of the lecture will go to your study guide. So let's go ahead and move along. Got 3 different screens open and my mouse, I don't know where my mouse is. Oh, my mouse needs to go that way and then it'll pop up over here. Here we go. Okay. So maintenance massage for athletes is the most common form of sports massage you will do. And unless your whole career is athletic events like basketball games, ring fights, marathon finish lines, unless you gear your practice towards specific athletic events, when you see your athletes, probably you're going to be in maintenance land. So this is something where it's more than 48 hours before or after the athletic event. If you're within that 48 hours, you want to switch to our event massage protocols, right? Now, our goal when we're doing maintenance massage for an athlete is to help that athlete with their training goals, right? So your massage session is going to vary a lot depending on who your athlete is. What type of athletic event do they do? How frequently do they train? What are their goals? All of this stuff. I do want to say that this type of massage is sometimes also called clinical sports massage, clinical sports. And because it is very similar to like a medical massage where it is very goal focused for our clients as athletes. There's nothing wrong with that title. I don't personally use it just because I see myself as more of a medical massage, clinical therapeutic massage therapist, and you're really using very similar techniques, like very similar deep tissue, advanced therapeutic type techniques for athletes as you would be, maybe someone has tennis elbow from tennis, but maybe they have it because they're a pharmacist and they're opening pill bottles all the time, So I don't personally use clinical sports massage therapist, even though that would be an accurate description of what I do, just because my clientele is more than just athletes. So anyway. Boop. All right, so who is your athlete? We have a couple of different ways that a person can be an athlete. And this is someplace where I personally disagree with some of the textbooks that are out there. And we'll talk about that as we go. So the first one is you have a full-time professional, right? So the sport is the client's primary employment. So this is someone who is a professional basketball player, a professional dancer, a professional football player, whatever, swimmer, you get it. So this is someone who their sport is their profession. They are going to have already a lot of support from coaches and trainers. And so if you are working with this population, you are probably working on a team, and you're going to need to have a lot of communication with their support staff. Sorry, making my mouse move around on my notes and it's hard. So you're going to be, you're the massage therapist, and you're there, you're talking to their sports doctor, you're talking to their coach, you're talking to the chiropractor, and you're all like on a team supporting these athletes, right? Some exceptions to that would be runners, because people can be professional runners and be getting what's it called? Sponsorship from Adidas, from Nike, if they keep good times at marathons, and they don't necessarily have a support team the way that a team sport player does, or a boxing coach does, or a boxer does. So it just depends a little bit, but they probably do have more support and more therapeutic intervention if they are professional. So your privacy policy, if you are working with a professional athlete, probably should include a disclaimer involving that your session notes are probably going to be shared with coaches and sports doctors, etc. That is very common practice in team-based settings, not just with athletes, but if you are to like work at the Mayo, or if you were to be a massage therapist somewhere, like at a physical therapy office, when they're getting their HIPAA privacy policy and they're signing off on that, there's going to be a spot in there where it says, you know, for continuity of care, your session notes will be shared among staff when appropriate for your care, or something like that. So that would be in there. So then that's the full-time professional. Now you have something that we call a competitive amateur. This is someone who, they have a 9-to-5, they have a day job, they have a job outside of the sport. The sport is not how they support themselves, but they're still a very dedicated athlete, devoting a lot of time to the sport outside of work. And this is where I personally disagree with some things you will read in textbooks. I have read textbooks that say, well, the competitive amateur is going to be less prone to injury because they're not, doing it 24/7 like a full-time professional. That is not my experience. In my experience, a dedicated competitive amateur is training honestly just as hard as a full-time professional. They can still be devoting 10 hours a day, 12 hours a day to their competitive art and cross training. Like maybe they're not doing ballet 10 hours a day, but they're doing ballet 6 to 8 hours a day, and they're running and they're weightlifting and they're doing yoga and they're doing other things. So they're still engaging in a same or similar level of dedication to this, even though it's a hobby. But they don't have the support, that dedicated athlete, that competitive amateur, they don't have the support team that the full-time professional has. So they're actually going to be more prone to injury because they don't have a coach, or if they do, they just don't have the money all the time. I've got someone knocking on my door, so I'm going to pause this recording if I can figure out how to do that. Okay, I am back. My apologies there. So that was a competitive amateur. Then you have the recreational amateur. So a recreational amateur is going to be somebody who, this is a really common category. These clients, the intensity, right, so this is the category of this recreational amateur. This is both the people who, their intensity is low, as well as the people whose the frequency is lower. So maybe they're hitting the gym, they're going hard, they're really pushing themselves, but they're only at the gym like twice a week, you know? Or maybe this is someone who, they do regular exercise, they exercise 5 or 6 days a week, but some of that is walking on a treadmill, some of that is a relaxation yoga class. So either the frequency or the intensity is going to be a little bit lower. The hours a week that they are spending in these physical activities is lower. They still have an active lifestyle. Maybe they're still regularly doing this thing, but it's more recreational. It's not like hours and hours every single day training really hard, getting them to their edge, right? So they're engaging in this specific sport for their own interest. And maybe that's medieval armored combat. Maybe that's archery. Maybe that's yoga, but they have this specific sport. They're not necessarily going to be out there doing a ton of cross training. The intensity or the frequency is low, and they're really a lot less likely to go to a competition or to push themselves too hard. This type of a person is the kind of person who's like, you know what, I had a hard weekend, I'm not going to yoga today. And they still go consistently, but just not that day. Or like, oh, I tweaked my wrist funny, I'm going to sit out of practice today. I'm going to sit out of kendo practice today. And they usually go. But just, they're going to take it easy and let themselves heal. These people are so much easier to work with. It's insane. Anyway, they still enjoy their sport. They still deserve to be able to participate in the fullest without injury, but they have a little bit less like neurotic sports-brained, must go, no pain, no gain, type of mentality. And then you have like that fitness or lifestyle client. So this is someone who's a little bit similar to recreational amateurs, but they're less attached to one specific sport. So your recreational amateur, this is the person who they're in a kendo club. They're in medieval armored combat. They're in, I don't know, guys, tennis, whatever. So, but they have a specific thing they're doing. They may have events related to that thing. They do it regularly, but they're really focused on just that, being able to do that one thing. Versus a fitness or a lifestyle client, they're always doing something, but they're going to switch it up. They're less attached to one specific activity. So they're going to have more variety in their movement, more variety in their activities. Maybe sometimes they're doing boxercise, and sometimes they're doing yoga, and sometimes they're doing CrossFit. Going to try out swimming for a while, and they're dedicated to being generally active. They're passionate about their overall wellness, but they're less attached to one specific expression of it. And these people absolutely can suffer from what I call sports brain. Sports brain is that no pain, no gain, better, faster, harder mentality that athletes get into, where they have to push themselves past the point of injury because they think that they've got something to prove or whatever. So these are just these people though are just in the pursuit of general excellence. All right, so and now I gotta get my, okay, if I go this way, the cursor comes back. Okay, here we go. Nope, I already did that one. Here we go. So, regardless of who your athlete is, like what category they fall into, there's still some questions that apply that we need to ask ourselves about working with these clients. So one is, what is the movement of their sport? Different sports have different demands on the body, and they work different muscle groups. So a marathon runner is going to have a different physique and be prone to different injuries than, say, a boxer. And a kendo practitioner is going to have different injuries than a judo practitioner, So you want to say, what is the movement of that sport? What are we going to think about where the problems are going to arise when we're working on the maintenance of this athlete and we're planning our sessions and how much time are we going to spend on what body area and all that, right? You need to know what is the intensity and frequency of the training. Is this someone who is training 6 hours a day, 6 days a week? Are they training 12 hours a day, 5 days a week? Are they training 2 hours a day, 3 days a week? The more often or intensely they train, the more frequently they should be doing massage. They should be putting just as much thought into their recovery as their recovery schedule and their maintenance schedule as they do into their training schedule. And this is something athletes never think about, because the exercise creates micro tears. Healing from those micro tears is what actually makes them stronger. So you'll have people who the exercise is the stimulus and they're exercising, but they never give their system the chance to fully heal and recover. So we want to, it is advisable and it is telling the truth to our athletes. The more often, the more intensely they train, the more they should be thinking about maintenance, massage, and self-care. It's good to know if they have other support or therapeutic professionals like sports doctors, coaches, trainers, physical therapists. These people cover niches that we do not cover. But it is helpful to say, hey, tell your coach that we found this, and to like communicate somewhat, even if you're not directly on the same team, you can pass messages through the client. It's good to eyeball the personality traits and self-awareness of your client. Is this someone who is going to push themselves too hard? Can they recognize when that happens? Will they listen to your recommendations? Because a real talk moment, there are massage therapists who want to know everything you know. They want to hear your assessment of their tissues. And there are clients, there are athletes who don't want to hear suggestions from you. Thank you very much. Reading your athlete is crucial because they are so performance driven that if they don't see that you are aiding in that, they're probably just gonna leave. So knowing the support level that your athlete wants is really important. Yeah, because you want them to give the greatest good that you can offer. You also need to know history of injury. It is really important for any client for you to know the history of injury, because now you're going to know where their scar tissue is accumulating and possible holding patterns and whatnot. Okay. See if I can start moving a little faster through this. So there are some conditions that are prevalent among all athletes. One is muscle strains. This is when we have torn muscle fibers. They're going to have pain, stiffness, possible a little bit of heat, depending on the severity. If they just strained a muscle, you should not stretch it. If they strained, like if they have a groin pull, don't stretch that tissue because it was torn. It needs a little bit of time to rest. This is the kind of thing we're going to rice at first. We're going to do gentle Swedish massage, lymphatic facilitation, maybe some trigger point work, especially in the compensating muscles. Especially a special note for the hamstring strain. The hamstrings are a very tight, thick area and may require more aggressive resting, like a longer period of rest. And them to refrain from any agility-based or sudden explosive movements until it is fully healed. Hamstrings cross two joints. They cross the hip and they cross the knee. So they are more prone to micro tears and being pulled and torn over and over again and building up scar tissue and getting stiff. It's a really common area for athletes to have long-term problems. The other one is a ligament sprain. So this is a slight rupture of the ligament. It's important to rule out fractures, like broken bones, because they can have similar causes. If you have someone who comes and they think they have a sprain, but it darkens to a full deep bruise within 10 minutes, it may be a fracture and they should get an x-ray. Once the swelling has gone down, gentle, limited cross-fiber friction on a ligament is just fine. Massage to surrounding muscles to prevent or disengage splinting is fine. Swedish massage, trigger point therapy, compensation patterns, and lymphatic facilitation after they've been cleared by a doctor is okay. Yeah, sorry. Oh, after doctor's okay. After the doctor has said that it's okay. Right. Then it's good. We can do all of these things once that swelling is down. A ligament sprain, once the swelling is down, we do not ice. It needs the extra blood flow. Okay, cursor needs to go back this way. Here we go. All right, some more conditions of note. We have tendinopathies. A variety of tendon conditions that are not the same as a sprain. A tendinosis is a degradation of the tendon's internal collagen due to chronic overuse. Many itises that we think of, like a tendinitis, a tennis elbow, many of these things are not actually a true tendinitis. They are a tendinosis. It's a degradation due to overuse, not an inflammation. And these we treat with a cross-fiber friction. Tenosynovitis is an adhesion between a tendon and its synovial sheath. Below the elbow, below the knee, and in the bicep in a couple areas. Our tendons have these synovial sheaths to reduce friction, and they can get stuck to the side of their sheath. You'll know it's tenosynovitis because you'll roll over a tendon and it'll feel like you've got gritty sandpaper granules along it. That tells you that's tenosynovitis. So for that, we put the muscle on stretch and then we work it like a cross-fiber friction while it's on stretch. A true tendinitis is an acute, painful inflammation, loss of range of motion. Usually it's chronic with collagen degeneration at the attachment site. And there'll be weakness and pain on resisted movements. And this is another cross-fiber friction situation. I will say sometimes people get cortisol shots. If that is administered, we need to wait to work on that area until that mushy, absent feeling is gone from the injection site. This will take a couple weeks. You can't work on something that had just got injected with a cortisol because it melts the tissue, and us getting in there will just mess with it. All right. Oh, I missed a whole category. Hang on. I got to go back to my previous slide. Then we have fasciitis and compartment syndrome. So fasciitis is inflammation of the fascia. Plantar fasciitis is the most common, but it can happen in other places. And we have a protocol for that, which I'll talk about later. Compartment syndrome is a muscle compartment that is bound up and swelling and filling with fluid. It cuts off its own circulation. If it is a chronic, reoccurring, exercise-induced compartment syndrome, we can work on it as massage therapist once the inflammation is calmed down. If it is an acute compartment syndrome, it's a medical emergency and they need to go to the doctor, like they need an ambulance. Contrast therapy, deep tissue massage, and lymphatic facilitation will all work just fine on athletic, chronic, exertional compartment syndrome. But if somebody if somebody smashes their shin in a soccer game, or they're having a severe flare-up, then they may need to go to the doctor for surgery for compartment syndrome. Fractures and dislocations, we don't work on them in the early acute stage, you guys. Don't massage broken bones. Once it's healed, we can work to restore function of the limb, release adhesions, and disrupt compensation patterns, and that would all be very normal. Okay, so when we're doing a maintenance massage, we have a couple of goals. We always honor and respect the client and yourself. So we want to be aware of sports brain and the pressure to chase results beyond healthy boundaries. sports brain is my word for when you run into that athlete and it's the type of thing that pressures athletes to take steroids and get in there. And what's going to happen is they are going to tell you more pressure, get in there. And you need to be the one who's the safe other in the room. You need to be the one who honors your client and yourself by respecting healthy boundaries and saying, harder isn't always better. Or this other technique, you can present it in a way of like, no, I'm not going to give you what you want. You can present it in a way of like, I know a trick that is actually more effective. And sometimes that helps get their attention. So we want to hold our center, our professional center, keep our good boundaries, and speak to the client about what a reasonable goal for the session would be. Because sometimes athletes are hoping for a quick fix scenario. And we need to tell them that in one session, we can get to, XYZ, but we can't fix everything in one session, right? So when we're addressing a problem area with maintenance massage, it's really classic deep tissue. When we're preventing injuries, we do this by increasing the range of motion, addressing trouble areas before they get symptomatic. This is why we want to know the movements of their sport. And we want to feel the differences in texture. So there have been times with athletes like my marathon runners, I'll go in and I'll feel along their Achilles tendon, up their calf, and I'm feeling for gritty, rough, textury spots, because that could be a spot where I now can see they're nursing a potential future injury, and I can like normalize that tissue before it becomes a problem. Right. And this is why, again, we want to know our athlete and know our sport so we know where to look for this stuff. And we want to increase their body awareness, because the more they receive sensation through their body, the more aware of their body they're going to be, and they're going to be able to catch their own injuries ahead of time. This happens naturally with more massage. It's helpful if you tell them to like put what they feel into words and describe stuff, and that helps. Oh boy, okay, how many more? Oh good, we're coming to the end. All right, we can do it. So treatment planning for athletes. So no matter what type of athlete you have, it's important to know the intensity, frequency, and duration of their training. And this dictates the level of therapeutic care their body needs. It is not too much to say that a professional athlete or a dedicated amateur should really be having some kind of massage or massage intervention once a week. I know it sounds like a lot, but that's that's ideal. Like in an ideal scenario, that's what would be happening. And you want to, you can tell them that. Like, it's okay for you to inform your client of what like a best case ideal scenario would be. So how do I get my cursor back over here? Here we go. Even if they're not financially able to attain that, at least now they know a little bit about what would be ideal and what they can work towards and approximate. So main types of athletic use to look for when we are working with our athletes is, first of all, a buildup of thickened fascia. This is basically a repetitive motion injury. And this is the one where it's the same, whether it's that shoulder issue from throwing a baseball or pouring a drink at the bar or being a hairstylist or whatever that repetitive motion is, that buildup of thickened fascia will happen. And so that's going to be the case even if it's not an athlete. One thing that is another type of overuse is a buildup of micro tears that are not given enough time to heal. And so this is the one where they've got muscles that are feeling like they're fatiguing too quickly, they're weakened, they always seem to be a little inflamed. Or you have a combination of these two things. And that's really the crux of athletic overuse. If a specific muscle area tires and weakens faster than it used to or faster than the neighboring muscles, have your client do an overtraining test. verify they don't have an event or a competition coming up within the next week or so. And the next slide is the overtraining test. So we need them to take 3 days of complete or active rest. Complete rest is best. This requires the client to limit activity to non-physical hobbies. So read a book, play a video game, sit on the couch and rest. Don't go to the gym. That's ideal. Active rest may be the best compromise for athletic types who don't want to be inactive, in which case easy physical activities like gentle yoga or walking are allowed, but nothing too strenuous. So that marathon runner is like, well, can I go on a short run? And I say, no, you can walk. You can go on a short walk for like a mile, but no, don't start running. You're going to defeat the purpose of the test. Then on day 4, they return to normal training, and they're going to notice one of 2 things. One, they are faster, sharper, and stronger than they were before. That tells them they needed more time to recover and should incorporate that additional rest time into their future workout plans. Now, massage should be more circulatory based for this client, like Swedish or lymphatic, because we know that getting that fluid exchange and getting that healing in there is the biggest thing they need to achieve their athletic goals. So this is someone who they were actually stealing their own edge, blunting their own potential by overtraining and not giving their tissues the time it needed to recover and strengthen. And so that's that client. Client or number 2, they're going to come back on day 4 and they're going to feel stiff, slower. They can't lift as much weight. It's like they kind of lost a little bit. These people have probably a buildup of fascia that is restricting fluid flow through the musculature. But their training schedule was maybe okay. So massage should use long, deep ironing strokes, cross fiber friction strokes, deep tissue techniques, broaden that fascia. And they're probably okay in terms of their training because that extra healing time didn't make them faster, stronger. But we now know that we really need to assess the state of that fascia because they got so stiff, right? All right. Lasting results for an athlete with a problem usually take full 6 sessions to manifest. So the intensity, frequency, and length of training dictates the intensity, frequency, and length of the massage sessions, but whether you're seeing them every 6 weeks or every month, usually it's going to take like 6 sessions to really see a difference. So they're going to, like, after that 6 sessions, they're going to be like, oh yeah, my shoulder is better. Oh, I can move more freely. Those hamstrings are looser, right? Now you may see it sooner. That's right. That's what my brain was trying to remember. You may see it before 6 weeks, but you should see it by 6 weeks. So if you're at 6 weeks or you're at 7 or you're at 8, not weeks, treatments, 6 treatments, 7 treatments, 8 treatments, and they are no different at all than when they started, it means you have not found the source of their problem. And that might mean you're barking up the wrong tree in where you are in the body, or it may mean you're barking up the wrong tree in massage. Like if they have a stiff, painful shoulder and you've massaged it and massaged it and massaged it, and it is no better than when you started, they may need to go in for like an MRI and make sure they don't have something else going on in that shoulder that requires surgery, you know? All right. So athletes who engaged in their sport daily may need to come in twice a week. Improvements come more slowly due to client being commonly engaged in the strenuous activity, and the fascial buildup requires holding pressure. Oh, I see what I'm saying here. I'm talking about toughies. Okay. back up. So it says twice a week, but it's really every 3 or 4 days. That is the most often you really should have anyone coming in for sustained deep tissue on one area, because they receive the massage and then it takes 2 or 3 days to fully integrate that work. So it's not until day 3 or 4 that you're going to know how much benefit you actually retained from that session. So on day 3 or 4, then you can get in there again and do another session, and the work that you previously had put in will have been integrated. And that would be the most. You really don't want to get, even if your athlete is training daily, you shouldn't be massaging them every day. They need time to integrate that work. If you've got someone with a lot of tissue buildup, it's going to take longer for those results to show, because they're always doing that sport and they're so built up already. So you're going to have to hold pressure, more pressure for longer to get a same change in the tissue. This can be really time consuming, especially if they have multiple problem areas, but you just have to have good communication with them about their treatment plan. So let's recap guidelines for session planning. If they have muscular overuse, we're going to promote circulation, right? We're going to promote that fluid exchange. If they have thickened fascia, we're going to broaden that fascia with deep tissue. Because of thick tissues, stay focused. You're going to stay in the focus area longer to create a change. You're probably not doing a full body session. This is the session where it's like 1 full hour on just the left leg below the knee. This is this type of session, right? You're staying on these focus areas longer. Sessions should be more frequent the more intense the training schedule. Professional athletes, you should be coordinating with their coach or trainer. Amateur athletes may need to recommend you're not their coach, but you may need to recommend small modifications to their training, so for their healing or wellness purposes. Results are often seen directly after the session, but lasting results will usually take that full 4 to 6 sessions to really start to sink into their body. And you should communicate to your client to adjust to their expectations accordingly. We need to work, and then we need to obviously create a plan that works with the client's athletic goals, but leaves room to switch event-based massage when a competition comes up. That is our event-based massage shindig. I hope this wasn't too horribly long. I am going to stop this video now and upload it. And thank you so much for coming on this ride with me. I will see you in the next video. Thanks, guys.